So I'm Simon Cleverly. I'm the Assistant Secretary for the Digital Health Branch in the Australian Government Department of Health and Aged Care. And that's quite a mouthful.
Thank you, Simon, for coming through here at HIC. And I'm looking forward to having a chat because it's the right time to have a conversation because there's a lot of things going on. But tell me, what brings you to HIC and what are you looking forward to?
Look, I think for a long time, everyone's seen the department as a bit of a sit out there and watch everything from the outside. But obviously, with the need for us to have a really consolidated health reform agenda, connecting all the parts of the funding reform side of things with the systems reform that we need to do that in lockstep. To be able to do that, we actually have to be a part of the community. And there's obviously a whole range of domains that we'll probably touch on that sort of goes into that. But, really it's about making sure that we are out listening, being a part of and making sure that the reform agenda and the policies we're putting forward are informed.
Yeah, absolutely. And look, I mean, there's a buzz generally within the ecosystem, and we've talked for a long time about what needs to happen. But I genuinely believe stuff is happening from ground up, but also top down. But for those that are kind of trying to navigate the landscape too, I mean, we've got Spark, we've got CSIRO, and we've got stuff happening through the Australian Digital Health Agency, and of course the department. Who's responsible for what? Who's in what lane, and what do we go to for the department versus all the other kind of areas?
Yeah, so I mean, it's a really good question because it is a very complex environment, and you didn't even touch on the states and territories.
Of course, states and territories, yeah.
And for the first time, the Australian government released a digital health blueprint in 2023, late 2023. It's the first time we've had a strategy at the Commonwealth level, the Australian government level, which is really sort of to auspice the significant investments that the Australian government is investing in systems reform. But that also helps to clarify the fact that whilst the Australian government really has a role in setting the policy direction and being really clear on where it wants to make reforms and the sequence of those reforms, we can't do it alone. And really, it's also about how we work together with states and territories, how we work with all the delivery partners. You touched on the agency, Health Direct, the CSIRO, and the list goes on. But it's also being really clear and to signal and provide those guardrails around where we want our innovators, the people that are actually really, really solid about being creative, just solving the really complex problems, which is why we're all here at HIC.
Yeah.
And to make sure that marketplace also has the right signals to be able to invest in the right way and that we all innovate in the right direction, that it's not just unfettered innovation, that we all have clear guardrails on where we're all going together.
Yeah. Love it. And so that's what we need. And you touched on it already that we've got the blueprint and some of these kind of indications that there in terms of what these guardrails look like and where the priorities are. But help me understand a little bit more about where these things are heading. Yeah,
sure. So, I mean, a really practical example is we've been talking a lot about sharing by default. A lot of people are asking us, well, what does that actually mean? Obviously, we have Australia's My Health Record system. It's an important part of the landscape. It's not the only part of the landscape, but it's really important that we make sure that we start to really change the way that we think about information flowing around the system. My Health Record is going to be a really, really critical part of that. And we're starting with the pathology and the diagnostic imaging sector, where we're going to start to require that if a report is generated, that it is uploaded for the benefit of the patient, but also for the patient's care team. We've seen some tremendous growth in the last 12 months since that policy was announced. I think we've seen somewhere in the order of about 33% growth in the number of diagnostic reports going into My Health Record and about 20% increase from a higher base of pathology reports going into My Health Record, somewhere in the order of about 10 million reports a month going up, and the reviews are going through the roof. So that is, the data's being used because the information's there. So that's the first one. The second one really is about healthcare identifiers. Just in Medicare system alone, when we started this agenda, we had about 87 different identifiers just in the Medicare administration system. We're in the tent too. We have the same problems. We've actually got to solve that and make sure that we can move forward with a clear pathway towards a single national healthcare identifier, working really closely with states and territories, with our delivery partners to make sure that we can do that. That's going to require legislative reform as well. But again, we've got to get the insights about the use cases where we really need to use those things. For example, at the moment, we have issues with the National Health Service Directory that can't consume those identifiers. So we've got to do a lot of work together to make sure that we can unstick that. And third and finally, I think really importantly, the Spark agenda. What's been so important about that is it has given us a mechanism to really build a community. And the whole process about building community is then about getting consensus around how we actually do the reforms.
Yeah.
And then obviously the regulatory reform piece that then sort of comes in to back those in it could be made really clear to people that are participating in the ecosystem, not only to be a part of the evolution or the revolution, but then also knowing going down the track that it is going to be a level playing field, because the expectations on the way that we go out moving information around the system will be consistent.
Yeah, absolutely. Oh, look, I think no one's going to argue with or disagree that we need all the different stakeholders involved to be able to collaborate and create solutions that'll be meaningful and aligned. But I think that examples, even what I've seen today and HIC, that there is truly like representation from everyone, like all the different stakeholders in some of these conversations, and whether be in the sessions or in breakfast or whatever, where you can have a really specific example shared by a psychologist who's had a particular challenge, and it's like, well, when I do this in this particular thing, and so when you're coming from another side, it can take something, a concept that can be quite theoretical or nebulous, and be like, okay, well, if we could do that, and then it starts to give context and fill the color into why we're actually trying to and what we're trying to do. And I feel like we're getting each time, and Spark has been a great, in my opinion, that Spark has been a great example of the real hands-on. We're very much at a rolling the sleeves up stage, and it's great to see that involvement in every direction. So are you feeling that kind of step change in terms of different parts of the ecosystem actually coming together to do some of this stuff?
Absolutely. And I think we've now got, as of today, every single state and territory signed up to be founding members of that program. That is a remarkable thing to have done since the launch of that program. It was only in the 23rd of August last year.
Yeah.
So in less than a year, we have published the first, core data for interoperability standard out of that environment. And that has been because we've actually had everybody participating in the process. I think I saw the last statistic was we've got about 20 aged care vendors now participating in that environment. So it's not just the standard, 10 vendors that always lead the entity and work really hard. It's everybody, and they realise that, this is going to be the mechanism that actually helps them, move to that new world of how do we move health information in real time around the system in a consistent way to really overcome the problems that you've talked about, which is, just because you are a provider working in a hospital here today, you might be someone working in a GP practice tomorrow. And we actually need to make sure that the information follows the patient. And at the moment, the way that information is stored in silos is really around the medical models of how we deliver healthcare. And so we're really sort of trying to flip that with programs like Spark. Think about how do we make sure the data can follow the patient around the health system and give the insights not only to the patient and their carers, but also to the providers, and then really create that feedback loop so that we have a learning health system going forward.
And lastly, Simon, I mean, we've done a good job in terms of outlining where we've got to so far and where some of the priorities are. But in terms of next steps from here, following HIC, what we can see over the next 6, 12, 24, where are your priorities really at to hone in on, and what might we say?
Well, we're doing a lot of work around not just the pipes part of it, not just the technology, but it's also about all the human factors of interoperability. So, we set up some new national governance. For the first time, we have a digital health oversight committee that reports to the health chief executives in this country, and that committee reports direct to health ministers. So we have that committee now that's making the big decisions around investing in things like the Health Information Exchange for Australia that's just been announced by the Digital Health Agency. So that's going to be a really big priority for us and all the states and territories to get that architecture right. But we're also really working hard through the legislative suite of things. I touched on some of those today. And then over the next really 12 months, it's going to be actually how do we use all these foundation capabilities to actually deliver demonstrable change into the system. So, for example, we are looking at building a patient summary now. There was some additional funding provided in the most recent budget to build out the patient summary. That's really going to be the ability to start thinking about how does that information port to follow the patient around the system. The second one's going to be really around chronic disease, chronic conditions and the management of chronic conditions, and how do we make sure that if we're going to do things like, different funding models, that's not just GPs and allied health providers need the data as well. How do we make sure the whole care team has the information? So using technology and capabilities to make sure that we can have that view in the whole of the patient's care team. And then the third one is really starting to talk about how do we start to get much richer information at the point of care around things like why is it that people are actually going to the doctor, that reason for health encounter, and less reliance on our administrative systems to be able to do the heavy lifting.
Yeah.